Hi, my name is Linda Cowles, and I'm the president of Anointed Community Services. And we're here to welcome you today to join us for another health and wellness session with Dr. Barbara Ansua. So join us, come right on into our Zoom room today and get some tips to help you stay well and healthy.
Hello, ladies. This is Dr. Barbara Ensor, and I'm here again today to offer you some health tips. We had a very exciting time last month, and this month we are going to continue on medications and then high blood pressure. This time I have some slides which you can look at and then go back and look at them and see what they say. So, um, basically, you have to remember that your health is in your hands, and what you do helps you in terms of staying healthy, whether in body, in soul, or in spirit. But today we will deal with the physical today. And like I said, we'll continue from where we started off on medications. Last month, we learned a few things about medications. The fact that we should know the names of our medicines. We should either have pictures of them on our cell phone, write the names on a piece of paper and keep it in our wallet, or even just type the names on your cell phone. So those are some of the things that you can do to have them ready when they are needed. And today we'll continue and we shall look at some slides. Um, Ms. Linda will project the slides and we will talk about side effects of medicines. So like I said before, the first slide shows taking care of your health and the fact that your health is in your hands. And being involved in your own health is very important, as we said last time. And there are many ways in which you can be involved in your health. The first one we mentioned was the names of the medicines you take and what each medicine is used for, so that when somebody meets you, a health professional is in contact with you, they would know that this particular medicine you're taking is for blood pressure or is for migraines. I think I mentioned the last time that some medicines are used for different things. And so we the health professionals cannot assume that what you're taking is for one thing, when in fact it may be for another thing. Then we also mentioned that the names of the conditions that you have, the medical conditions that you have to know whether you have high blood pressure, diabetes, migraine. All of that is important so that when you interact with a health professional, you will be able to let them know that you are in charge of your health. You know what conditions you have and what you take for them. And this makes the interaction very meaningful. And doctors and nurse practitioners are usually very happy when they know that a patient knows about their medical conditions and the medicines that they take. The other thing you can do when you are in charge of your health is to buy the things that are needed. For example, I think everybody who has high blood pressure, for example, can purchase a blood pressure cuff to use at home. This is important because sometimes people come to the clinic and because of excitement and everything, their blood pressure is usually high at the clinic. And at home, the blood pressure is low. So if you buy a blood pressure cuff, check your blood pressure at home, bring the readings to you to the clinic together with the cuff that you have. Then they can measure your blood pressure at the clinic with both the clinic cuff and your cuff. And if they are about the same, then we know that the readings are at home are good readings. And that maybe you have what we call white coat hypertension. That is when you come to the clinic, your readings tend to be a little bit high. So with that said, we want to go a little bit more deep into medications. Medications, medicines, drugs are used interchangeably by health professionals. And there are two main types of medicines. We have the prescription ones, which the doctor or the nurse practitioner or the physician assistant will write for you or will send by e-scribe to the pharmacy. And then we have over-the-counter medications. In general, the over-the-counter medications are about 60% of the total number of medicines, while the prescription ones are about 40%. And as you know, over-the-counter medications, you can just walk into a drugstore and get a pharmacy and get those medications. It is very important that you follow the instructions on the bottle when you buy it, because some of the medicines, for example, if you had a cold and you went and bought some medicine for cough and cold, it will tell you not to use it more than 5 days or so. Now, the reason is because they expect that by 5 days you should be feeling better. But if you are not, then it means that you should see your doctor so that they can have a closer look at what is happening to you. So over-the-counter medicines, like for acute medical stuff, like a cold or like you have a little bit of maybe acid reflux and you buy acid reflux medicine, you use it only for the number of days that it says on the container. As you know, prescription medications must be acquired by a written prescription from a healthcare provider. Now, you should realize that all medications, including plain old Tylenol, also known as acetaminophen, all medications have some side effects or problems, or intolerance is the other thing that they may have. And so we'll go a little bit into those. Okay, so like I said, all medications may have some side effects. For example, if you take aspirin, sometimes people use aspirin to prevent strokes or heart attacks and so on. And usually the ones for given to you for those conditions, they are what we call enteric coated. That means that they have a coating or a protection around them. And when you swallow that medicine and it doesn't give you acid burn, reflux or acid heartburn because it is coated. And so it goes into your stomach before the aspirin itself starts to work. And it is important that if you are taking a medicine like aspirin, if it's causing stomach pain or irritation, you make sure that you take it with food and you make sure that you're taking the enteric coated type instead of the plain one. Now, I must remind you that if people have chest pain and they are usually given some aspirin, that aspirin they are given is not enteric coated. Those aspirins are regular aspirins because it takes a shorter time for them to have their maximum effect, unlike the coated ones. So remember that. Now, there are some blood pressure medicines known as ACE inhibitors. An example of that is lisinopril or benazepril. These can cause side effects, and some of them are cough. If you are on a pill like lisinopril or enalapril, benazepril, sorry, and you find out that you have this dry cough, which does not go away, it is important that you talk to your doctor about it because that may be a side effect of this particular group of medicines. And it tends to be more common in African Americans, these side effects in this particular type of medications known as the ACE inhibitors. And like I said, an example is lisinopril or benazepril. Not only may it cause an irritating dry cough, those may also end up with you having swelling of your lips and stuff like that. And so it's very important that if you're taking this particular group of medicines for high blood pressure or for kidney disease, and you experience a cough, you talk to your healthcare provider so that they will change and give you another type of medicine. Same for blood pressure. Now, there's another type of blood pressure medicine known as amlodipine or nifedipine. I'm sure that some people with high blood pressure are on those medicines as well. And high doses of this may cause swelling of your legs. Now, what is the solution? They may decrease the dose, or they may add a diuretic, which we refer to sometimes as a water pill, to stop the swelling. Usually, if you're on like 2.5 milligram or 5 milligrams, you do pretty well and you don't have swelling. It's usually when people are on 10 milligram or more than that, that they may experience swelling of their legs. The other group of medicine I want us to mention is statins. Statins are used for high cholesterol. For those of you who have high cholesterol, your doctor may have given you a statin. And an example of, they all end up in statins. That's why they are called statins. An example is atorvastatin or simvastatin. A few people may get muscle aches when they take this. And it has been found that a lot of people who have the muscle aches have decrease of a chemical known as CoQ10. And so if you start having muscle aches on these medicines, the doctor may either ask you to take CoQ10, or they may ask you to take the medicine at night instead of during the day. Another thing that happens with statins, again, I say that it's just a small group of people. You may have abnormal liver enzymes. These are chemicals in our bodies that may increase. And the doctor may decrease the dose of the statin, and you may be okay after that. Antibiotics also may cause some side effects. For example, there are some people, when you take amoxicillin, which is a type of penicillin, they may get a yeast infection and you end up with vaginal itching or a discharge. And what they do is that sometimes the antibiotics, when they go into your intestines, they may kill the normal bacteria as well as the bacteria causing whatever infection you were given the antibiotic for. And so when that happens, the normal balance of bacteria that is in your gut and in your vagina is upset. And when that happens, you may get a yeast infection. And in that case, we sometimes advise people who are going to take antibiotics to take probiotics. I'm sure you've all heard about probiotics. And there are certain yogurt brands which have probiotics in them. So you can also take that while you're taking your antibiotics to prevent yeast infection. It tends to happen with the penicillins, but others may also cause yeast infection, but it's not as common. The doctor may also give you an anti-yeast medicine. Okay, it's called diflucan, and I'm sure a lot of you have taken diflucan for that. Okay, now diuretics, that's the last one I'm going to talk about. Diuretics are the same as what we call water pills. And the most common one people take is known as hydrochlorothiazide. It either comes by itself or it's combined with another blood pressure medicine. And we use it for blood pressure control. Sometimes when we mention water pill, people don't realize that it is a pill that removes excess water from your body, and that lowers your blood pressure. So if you're on a water pill, it can sometimes cause your potassium levels to go down, because when you pee the water out, you're peeing out potassium as well. And potassium is very important for your muscles and for your heart. And that's why it's important that when you are on water pill, You make sure that your doctor does blood work on you at least twice a year to make sure that your potassium levels are fine. When they find out that the potassium levels are low, then what normally happens is that you may be either advised to use over-the-counter potassium, or they'll give you a prescription potassium, or sometimes when your water pill dose is so low, we ask you eat some bananas. Bananas are high in potassium, and that may replace some of what you're losing. Slide. Now we're going to talk about drug allergies and intolerance. A drug allergy occurs when your body recognizes the medication as foreign or an intruder. And so your body would release chemicals to fight that intruder, which is the drug. So chemicals are released. And when they are released into the system, what happens is that you may end up with a rash, cough, like we mentioned previously, itching, swelling of the tongue, mouth, and throat. And the most serious drug allergy reactions is when there's anaphylaxis. And this is a more severe reaction where you can't breathe and your throat is closing. And that is definitely a 911 call if it happens like that. But if you do have rash or cough, you must inform your health care provider that you had a reaction to that. And then they'll put in your chart that you are allergic to that particular medicine. It could be penicillin, it could be sulfur, it could be lisinopril, like I mentioned earlier on. Now, there's a difference between drug allergies and drug intolerance, okay? If you are intolerant to a drug, it means it's not due to an allergic reaction. It doesn't involve the immune system. For example, when people take narcotics like codeine or hydrocodone, sometimes it may cause nausea, vomiting, or constipation. The solution is that you can be given an anti-nausea medicine. If it's constipation, you'll be given a stool softener to help. You find that is very common in people who are taking these pain pills for either cancer pain or other severe pains. We've discussed this already, so we'll skip this slide. Now, in talking about drugs or medications, we have to remember the group of drugs known as complementary and alternative medicine products. These are what you can buy over the counter or at the health food store. I mentioned to you that all drugs, whether they are prescription, over the counter, or even what we call the CAM products, may have side effects. The truth about CAM products or dietary supplements is that they are not regulated by the FDA. And so they are also not supposed to diagnose or treat any medical conditions. You'll find out that when you look on the bottle, that is what it would say. So don't assume that when a drug says natural, it means it doesn't have any side effects. That's not correct. Some may have other medications also added to them, unfortunately, because there are some drug companies out there who do not do things right. So there are some, for example, for men, they may buy camp supplements, which may say it's for ED or erectile dysfunction. And you find out that sometimes when those medicines are studied well, they find out that people have added a medicine like Viagra to that medication, but it's not listed on the contents when you buy that medicine. So you have to be careful about that. I have on the screen a good source of information about supplements and research that has been done to let the public know whether what they said what it said they treat is really what they say it treats. So the source is on the screen, and it's known as the National Center for Complementary and Integrative Medicine. So I think we talked a little bit about tips for remembering what meds you take and when to take them. So we will not go through this slide right now. But I just want to mention about that before we go. Our time is running fast. We have about 2 minutes. Yeah. But before we do that, I want to show you these containers. These are my own. That's the containers I use to keep my medicines in. Okay. And you know that it says Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday. So each Sunday, if you take a lot of medicines, just arrange them. Then you do not forget, because some of us, we may forget our medications, whether we've taken them or not. So that brings us to the end of our presentation on medication side effects and knowing your medicines. I know we spent 2 sessions on this, but I felt it was very important. And next month, we'll talk about hypertension, the silent killer. It was nice being with you. Thank you for your attention, and we will see you again next month. Bye, and God bless you.
So I hope you enjoyed the segment today on health and wellness. And I do want to remind you that this broadcast, this particular taping, is done in reference to our Women's Ignite Network for our WIN members, teaching women how to take better care of their health. And we want to remind you about Dr. Barbara's book, and we will have a copy here in our WIN office at Anointed Community Services. And this is her book, A Woman's Guide to Her Body and Her Total Health. So this book, you would be able to purchase this book from Amazon, and maybe we'll have a few copies that you can purchase right here at Anointed Community Services. So remember, all of our WIN members, your Women Inspire, Women Ignite, I'm sorry, we just changed our name, but Women Ignite Network. As a WIN member, you are always a winner. So stay tuned for our next health and wellness session with Dr. Barbara so that you can learn these great tips and you can take care of your body, which is the temple of God. God bless you. We'll see you next month. Have a wonderful month. Bye-bye.